Thank you very much, Maria-Lise, for a really informative presentation. Before we continue, I just wanted to make one clarification. What is so much of the World Bank doing here at this room today and at this panel now? We have been asked to provide advisory services to the Ministry of Health because the ministry has recognized that even though there are some sporadic initiatives by different players in the arena to advance and work on telemedicine, the ministry has recognized the need for systematic effort, and we are very pleased and honored to be a part of this puzzle and to be able to share our knowledge and our experience with you. And starting from your excellent presentation and very informative, Maria-Lise, based on all that you have seen so far, and this is many different countries, some are comparable to our setting here, some are not, but then again, some knowledge is universal. What would be your advice, not necessarily maybe do's and don'ts, but the do's? What would be your top couple recommendations for Slovakian context?
Yeah, thank you very much, Tatjana. So the main and first point that I would raise is that I think it is really important to get the definitions right. For a country that has had sporadic and piecemeal approaches to telemedicine, the first thing to do is that we need to be very clear on what do we mean by telemedicine in the Slovakian context. For example, a patient that is given a wearable, a patient with high blood pressure that is given a wearable, like a watch that can check their blood pressure on a regular basis, on a continuous basis, and alert the doctor and the patient if it goes consistently above a certain level. Is that considered part of telemedicine? Is other forms of remote patient monitoring? Is a doctor checking in with the patient to make sure that they're still taking their insulin medication? Is that a form of telemedicine? Definitions are really important. And then what goes with definitions is the enabling regulations. You know, we often think about regulations as constricting and preventing things from happening. But what often happens in the case of telemedicine is that the regulations are so strict and they're so inconsistent that it's very difficult, for example, because of data protection requirements, to even start to implement telemedicine services because doctors don't know what to do with the data that is generated and captured during a telemedicine visit and so on. And then the third issue is in the area of financing and reimbursement. We have to, once we know clearly what telemedicine visits are, what telemedicine is, what a telemedicine service exists of, and the types of telemedicine services that can form part of in-person healthcare. It doesn't need to be either fully telemedicine or fully in-person. It can be a hybrid model as well. Once we're clear on what that means, what does that mean for health insurance reimbursement? Which of those services would the health insurance agency reimburse? At what levels would they reimburse it? And that is important. And then the last area that I would say is in the area of building trust and awareness. You know, people who have been used to receiving healthcare in a certain way, and providers, health professionals who've been used to delivering healthcare in a certain way, may be resistant to telemedicine and may have some perceptions around the quality of a virtual visit to a doctor. So the issues around awareness raising and trust building is equally important, not just the technology and regulatory dimensions and the financing dimensions, but also the trust and awareness raising dimensions. Back to you.
Thank you very much, Marilise. These are all super important and excellent points, and we are taking them into account, I would say. I would like to come back to Tatjana Prenja-Trupec, who is today wearing multiple hats. Those who are here longer have seen her earlier talking on value-based care. However, she has been part of pioneering telemedicine in a number of EU countries. And so we would like to slowly come back to this part of the world. And Tatjana, can you share with us some of the experience from the EU?
So,
in the countries you have worked.
Yeah, EU really has a lot of very, very good examples. Let's start with Estonia, which is the first in the world and the best in the world. So what Marilisa wrote in her presentations, they fully live digital first. So they completely embedded telemedicine in their clinical pathways. They don't really differentiate what is telemedicine, what is not. In pricing, in performing, all the doctors are educated, all the patients are willing, everything is simplified in a way that telemedicine is fully embedded in healthcare delivery. In Croatia, for us, it is crucial to have telemedicine because these 16 inhabited islands that we have. So we started very early with this, also what Marilisa wrote, provider to provider. So we actually supported GPs and nurses on our islands to provide teledermatology, teleradiology, teleneurology, so early stroke detection. We really put in this, for the islands, a lot of services. We defined 20 services very early. We put in the legislation that also these services and who can provide, who cannot. So we invested a lot in Croatia, in telemedicine for many years now. And for Slovenia, for example, they concentrated on primary care as the foundation of every health system. And they saw that they, for example, have decrease in visits, home visits because of shortage of doctors, what Marilisa also said. And they started this telemedicine between nurses, field nurses and doctors, and they have very good patient outcomes, especially for vulnerable groups. So a lot of very good examples in the region, and applicable to Slovakia.
Thank you very much. And now we can go back home to Slovakia. So Mr. Tomáš Švec, the head of digital department of the Ministry of Health. Can you tell us how did you come to this idea to mainstream and work on basically putting the strategy and telemedicine as such on a map of healthcare system?
Okay, thank you. We, Ministry as the regulator, should address the key challenges which Marilise mentioned in her presentation in the beginning. And regarding the telemedicine, we didn't see telemedicine as a digital project. We see the telemedicine as a complex system which have several layers. It has a technological layer, it has a financial, clinical, and of course legislative layer. So we see that we need to challenge these layers simultaneously and set up the strategy for all these layers together. So we need to align these layers. And we start with cooperation with the World Bank and cooperation with you and World Bank's experts. Our approach was starting the multi-round communication with all stakeholders involved, because we clearly see the interest of all stakeholders, insurance companies, patients, and of course the private sector and the vendors, because there is a lot of already solutions on the market, but we need to put these layers together. And our main goal is to put using the telemedicine in the real practice, not create isolated system.
I think we are all in agreement with that. In terms of how do you perceive now going, there is a vision, there is a consensus, and from where we sit, we can confirm that there have been really extensive consultations with a broad range of agents involved in different ways and interested in different ways in telemedicine. So transparency and inclusion have been there from the day one. So now, when, let's say, diagnostics is in place and the vision is in place, how do you see the going forward?
Okay, for now, the first output of our collaboration is the analysis and set of recommendations based on benchmarking and best practices from abroad, and in the future, or in the next weeks, we together will work on overall strategy which will bring specific roadmap of the steps and actions we need to do. We need to set the responsibilities, KPIs, and clear vision and tangible steps of what we should to do in the short term.
Thank you. So we were talking about recommendations and do's and what to do, and but then whenever you're introducing something novel, there are challenges. Of course, we are all used to do things the old ways, and accepting the novelty, especially in this rapidly changing environment, can be a challenge for both professionals, healthcare providers, but also patients. Marilisa mentioned there were studies, and these studies were done for a reason, to compare the quality of care provided through telemedicine and care provided in person. But we have seen that, and not only with telemedicine, but with any innovation. How, and I would like to ask you, Tatjana, how do you bridge that gap? How do you motivate care providers and patients to enter, to accept?
So the resistance is on any change is very normal in every area. So in this particularly, as this is something new, and people always doubt if they have enough digital literature to be in. What is shown in many countries that this that processes should be simplified. So, for example, identification of the patient, consent of the patient to participate, consent to check the data by professional, to see the data. So these are some things that should be simplified. Web applications should be user-friendly. Healthcare providers should be incentivized in a way that, for example, when introducing telemedicine, the price of the same in-person or remote service should be a little bit higher price. There should be clarity, like enough services defined so that healthcare providers don't look which one should I charge. So they know exactly that if it's remote monitoring of heart, then I should charge remote monitoring of heart. Doctors, primary healthcare doctors should be incentivized to use, even for some small part, like preparing a patient for telemedicine with neurologists, like for early detection of stroke. Everything should be user-friendly, and tools should be available. So if healthcare providers have available tools to provide telemedicine, to provide teleradiology, to provide, they will do it. So this is something that should be done on a policy level with legislation and reimbursement, and with clear clinical pathways what should be done, and with some simplification regarding patient safety and accountability of the doctors which are providing telemedicine.
Thank you. And for Marilisa, same question, but you mentioned some good practices, for example, carbon offset in Brazil, on how to motivate patients, but also our patients, and we are all patients potentially in some areas, but especially the elderly, the ones who are not maybe technologically savvy. How do you motivate patients to trust and use telemedicine services?
You know, I have three suggestions here, and they all start with a C, but that's just a coincidence. The first one is convenience, right? I think focusing on those services first that bring patients the most convenience is really important. So for a patient, a person with diabetes, to be able to do a quick remote visit because they already have a continuous glucose monitor and they can check in remotely in the 10 minutes that they sit in the car waiting to pick up their child from school to say, hey, doctor, everything's fine. My CGM results are still good. Please, can you renew my prescription? So much more convenient than having to make an appointment, scheduling it with one's own calendar and life and all those things. So the issue of convenience is really important. The second is an issue of choice. Patients should never feel that they don't have a choice. I think if we think about behavioral motivation and we think about health behavioral motivation in general, there are different types of people, right? There are people who want to use technology, and there are people who is just going to be a little more slow in adopting new technologies. I think the worst we can do is to have a utilitarian approach and not take the patient and their preferences into account. So there should always be a choice. There might always be a subset of patients for whom an in-person visit, a doctor's hand on their shoulder, a caring person looking them in the eye is really important. And we should not discard that because that is part of their health journey. So the second one is the issue of choice. And then the third area is in the issue of caregivers. And I am a strong proponent for thinking about telemedicine not just as an interaction between a doctor and a patient, but for some patients, a three-way interaction between a doctor, a patient, and their caregiver. And I think we need to keep caregiver perspectives in mind here as well. It may just be that for an older person who struggles to see on a small phone screen, or whose hands, the keyboard on a phone might be too small for them to comfortably use, there's technology adaptations that can be made for that. But we also need to keep in mind that in some cases, we may need to cater some kind of telemedicine services to bring the caregiver into the clinical discussion, obviously with the permission of the patient, but to ensure that there is somebody who can help. Our first priority should be for those patients who really want the service, who crave that convenience, to make sure there is nothing that stands in their way. Because if we can get 50 or 60% of our, patients with diabetes out of the clinic, and we can deliver them good quality remote patient monitoring services, we can spend more time on the other 30 or 40% of patients who are either complicated cases, who have comorbidities, or who just want that in-person touch, because that helps them have more agency and look after their healthcare in a more positive way.
Thank you so much, Marilisa, and your words were followed by music somehow in a prophetic way. Thank you all for this great conversation, and I really believe that we are together under your leadership on the right path, and hopefully for the next Etapa conference we will be able to present some success stories.
Thank you. Bye-bye.